On today's podcast, we're going to talk all about how to flatten your tummy. We'll talk about bloating, we'll talk about belly fat, we'll talk about tummy tucks, basically everything you need to know about how to flatten your tummy, whether it's surgically or non-surgically. All right, so let's start by talking about the difference between bloating versus belly fat versus excess skin. Because if you're looking to try to flatten your tummy, the cause of why your tummy isn't flat is the first thing we want to figure out. So what is bloating? Well, bloating is a condition where people get excessive, basically gas inside their intestines, causing them to feel basically real bloated. And sometimes people can get bloated from drinking something as minimal as water. Yes, there are people who drink water and they get really bloated afterwards. Now, one of the main reasons why we think people have issues with bloating is due to the microbiome. Now, the microbiome are the trillions of bacteria that live inside our gut. And these bacteria are so incredibly important, not only to the health of our gut, but to the actual health of our whole body. And this is something that we've been learning about. You know, alternative medicine doctors have been talking about this for decades. Traditional doctors are now getting more into it because they're realizing that there is a lot of truth to the importance of the microbiome. So how do you get your microbiome in order? If you've got bloating issues, this is the first thing I encourage you to try to figure out or to try to work on, okay? So there are certain things you want to do to try to help promote a healthy gut microbiome. The first thing is very simple, is to take a daily probiotic, at least 3 billion colony-forming units. Probiotics are basically healthy bacteria that you take in a pill or a capsule form, and those healthy bacteria are there to essentially populate your gut. And so taking a daily probiotic can definitely help. There's some probiotics that are very minimal in how much they can help if they've got less than 3 billion colony-forming units, as well as if they only have, let's say, 1 or 2 strains of bacteria that may not be as helpful for a probiotic that has, let's say, several strains and many more billions of colony-forming units. How can you then get probiotics or healthy bacteria into your gut through food? Well, that is through fermented foods. Now, the standard American diet is essentially sterile. It's devoid of fermented foods because those are foods that just are not all that appealing to the general American population. So these are foods like miso, like tempeh, like sauerkraut, like my favorite kimchi. Kombucha is a drink. Kefir is also a drink that contains probiotics. And when you look at the standard American diet, there's very few probiotics in it at all, almost none. We get our probiotics here in the United States either through yogurt, which is a reasonable source of it, or if you're having brats at the ballpark, maybe you'll throw a little sauerkraut on it, and that's basically it. And so trying to focus on foods that are rich in those healthy probiotics, these fermented foods, and trying to eat them once, maybe twice a week could be very beneficial for your gut and may help with your bloating as well. If you've got bloating issues and let's say you say, hey, I am taking a daily probiotic, I have started trying fermented foods, but man, that bloating is still a problem, then you may want to look at potential food sensitivities. So some people will try doing an elimination type of a diet. And there are certain foods that you may eat that could cause bloating to become more of an issue. One of the big offenders is dairy. You know, if you're Caucasian, then the majority of Caucasians, basically Western and Eastern Europeans, are not lactose intolerant. But amongst Asian, African Americans, amongst Latinos, there's a high percentage that are lactose intolerant, and some people probably don't know it. And so starting out by taking dairy out of your diet and seeing if your bloating improves is a really good start. You can try reducing gluten. Gluten can be bloating for some people. Now you may say, hey, why would I get rid of gluten if I'm not celiac? Well, about 1% of the population is celiac, but there is a huge percentage of the population, maybe 10%, maybe more, who are gluten sensitive. So you may not be celiac, your body may tolerate gluten, but your gut may find that whenever you eat gluten, or if you eat too much of it, that you can have problems with digestion. And there's a lot into that that's beyond the scope of this podcast, and when you're talking about leaky gut and things like that. The other two groups of foods that you may want to consider eliminating and seeing if your bloating gets better are ultra-processed foods and foods with excess added sugar, like sugary drinks. We do know that when you look at the gut microbiome, there's the healthy bacteria and there's the unhealthy bacteria. The unhealthy bacteria, they are promoted, or they like essentially sugar. And so if you're having a high sugar diet, that is going to promote the unhealthy bacteria to proliferate. Healthy bacteria proliferate through eating a diet rich in those fermented foods, but also eating a diet filled with good prebiotics. And these are fiber-rich type foods. So colorful fruits and vegetables, that is a great alternative to these sugary drinks. Colorful fruits and vegetables, fruits and veggies in general, are going to help promote a more healthy gut microbiome. Sugar sweetened drinks and sugary foods are going to promote the unhealthy microbiome. And then once again, getting rid of those ultra processed foods or limiting them can also help as well. Now, if you're having major bloating issues, I encourage you to seek a functional medicine practitioner and or a gastroenterologist. Both of these, gastroenterologists are physicians who are specially trained in the health of the gut. And functional medicine doctors often will really dial into your diet and your lifestyle and those types of things that can make a big impact on bloating and your GI issues. So that's the idea with bloating. And bloating is something that you should be able to separate bloating from belly fat, because bloating goes up and down throughout the course of a day. Okay, you may find that you wake up in the morning and your tummy is nice and flat and you feel great, and then at dinner time you feel huge. That's more likely a bloating issue, because fat does not go up and down throughout the process of a day. Neither does excess skin. So if the issue is that isn't an up and down situation with your tummy, but let's say you feel that your tummy is always round and filled out, then you're probably dealing with more of a belly fat issue. And there are two types of belly fat to keep in mind. There's visceral fat and there's subcutaneous fat. Visceral fat is fat that's on the inside of our abdomen. It's around our inner organs, like it's around our intestines, it's around our kidneys, and all the inner organs of our abdomen. Subcutaneous fat is fat that is underneath the skin but above the muscle. And the way to tell the difference is subcutaneous fat you can pinch between your fingers. So if you can pinch the fat between your fingers, then that's most likely subcutaneous, fat below the skin and above the muscle. If, however, you have a tummy where your tummy is just protuberant, it's round, especially if your mom or your dad has the same thing, then most likely that is visceral fat. Visceral fat is fat that you cannot pinch because it's underneath that muscle layer. It's deep on the inside. It's also a fat that is considered to be the quote-unquote unhealthy fat. And so ideally you don't want to have a lot of visceral fat. Now, visceral fat, I do find, really runs in families. It is genetic. You can inherit visceral fat patterns from your parents. And I see this all the time. So if, let's say, your mom or your dad had a really round tummy, then it's definitely likely that you will as well. And there's some people that when they gain weight, they don't gain in their arms or their legs or their butt or their thighs. They gain it on the inside of their abdomen as visceral fat. Other people, when they gain weight, maybe they'll gain subcutaneous fat. Maybe they gain weight in the butt or in the hips or the thighs or underneath the chin. That's a different type of fat. So how do you get rid of visceral fat? It is very difficult. You cannot liposuction visceral fat. You cannot cut it out. This is fat that you can only get rid of naturally. Now, there are some doctors, like my good friend Dr. Mary Claire Haver. She's got a belly fat challenge that she does every several months with her followers, where if you reduce the overall amount of inflammation in your body, that can help reduce the amount of visceral fat that you have. And so that's something that definitely, if you've got a visceral fat issue, doing her belly fat challenge may be helpful for you. But really, in the end, with visceral fat, it does come down to diet and exercise. We cannot liposuction that fat away. We cannot surgically remove it. You have to do it yourself. And I'll tell you, it's tough. It really is, because there is that genetic component to it. Sometimes when you genetically inherit a fat pattern distribution, that's the last fat that will go away when you try to lose weight. And it's tough, but that's the truth. All right, so now we've talked about visceral fat, tough to deal with, diet and exercise. How about subcutaneous fat, that fat that you can pinch between your fingers? Well, there are a lot of ways to get rid of subcutaneous fat. Obviously, you can do diet and exercise, like with visceral fat, that's going to reduce subcutaneous fat as well. But that's also the fact that you can do different interventions to get rid of. So you can do liposuction. Liposuction basically is made to suck out, physically, mechanically remove subcutaneous fat. And when those fat cells are removed, unless you, let's say, gain a lot of weight, that fat should not come back. Okay, now those fat cells will not come back, but the fat cells that we leave behind can get larger if you gain weight. Liposuction is a very permanent and the most effective way to get rid of subcutaneous fat pockets. I encourage people, if you're going to consider liposuction, keep in mind it's not a weight loss procedure. Liposuction is for stubborn areas of subcutaneous fat that you can't get rid of. So for the love handles, for the lower abdomen, especially if you haven't had children or if you're a guy, then lipo can be really effective for that type of fat. What about cool sculpting or sculpture? So there are non-invasive ways to get rid of fat as well. And this is what I consider, honestly, to be the holy grail of plastic surgery. When I finished my residency training, we didn't have any of these options. It was when people say, hey, I want to get rid of a little fat, you had to suction it out, liposuction it. Even if it was a small area of fat, we didn't have any other way to get rid of it but lipo. Well, now we've got non-invasive fat reduction treatments. The first big one was called cool sculpting. And essentially cool sculpting, you freeze the fat, those fat cells will crystallize, and then your body will actually get rid of those fat cells naturally. Sculpture does the same thing, but it does it using a laser. So the laser will heat up the fat, and that will cause those fat cells to essentially die off, and then the body clears it naturally. Now, in my office, we have sculpture. A lot of offices have cool sculpting. The main issue you got to consider with cool sculpting is that there is a risk of what we call paradoxical adipose hyperplasia. And this is a term given to about 1% or so of patients who have cool sculpting, where instead of losing fat, they actually gain fat in that area. Yes, you go to a doctor, you have a treatment that you spend $1,000, $2,000 on to get rid of fat, and the opposite happens. And I have seen that in a couple of patients. I had one patient who had cool sculpting in her submentum, which is the double chin area, and that double chin like tripled in size afterwards. And then she came to see me and we liposuctioned her. I had another patient who had cool sculpting done to her abdomen, and that made the abdomen look much larger afterwards. And so we did a tummy tuck, combined that with liposuction on her. So it doesn't happen to everybody. Like studies show it's maybe 1% of patients, maybe a little bit less. But that's something to keep in mind. You don't get that with sculpture, and that's one reason why I have the sculpture device, not cool sculpting. But both of them, in my opinion, and studies show, are fairly equally effective in modestly reducing the thickness of fat, maybe by about 20% after 1 or 2 treatments. Now, Kybella is an injection that we can use to melt fat underneath the chin. It's FDA approved for that. Or you can melt fat in small areas around in the body. That's not FDA approved, but you can use it off-label. So Kybella is an injection of deoxycholic acid. This is a naturally occurring substance in our GI tract that basically dissolves away fat. So you take that substance, you market it as a fat melter, and you can inject it in the double chin area, and it really does work. It is inflammatory, so you get quite a bit of swelling afterwards. You may get some numbness and some bruising, but it really does work for most patients. And now we also use it for small little touch-up type areas too. And so if you got a small area of fat, like let's say you had liposuction before and you got a little bit of unevenness, then that's something that Kybella may be helpful for. But it's not good for huge areas because it gets really expensive. Now, I've seen some videos where people have had Kybella injected throughout their abdomen. Bad idea, because it's so expensive. It takes multiple treatments. It's better just to do lipo if you're going to do a large area. If you got a little small area like the double chin, maybe like the front of the armpits, we do that sometimes, then those small areas can be very helpful using Kybella because you don't have to go to surgery. That's how to get rid of subcutaneous fat, essentially with liposuction and some of these non-surgical options. Well, what about a diastasis? So a diastasis is something that a lot of women who've had multiple children deal with, and that is essentially a separation of the rectus muscles of the tummy. So what is that? Well, we all have 2 paired muscles that come straight down our tummy called the rectus muscles, and they have tendinous inscriptions that give people a six-pack. When you become pregnant, those muscles get stretched out and separated. And after multiple pregnancies, sometimes those muscles don't come back all the way. And you can get a separation between those muscles called the diastasis. That separation can cause some people in extreme situations to have a protuberant tummy, where their tummy can literally stick out from all the looseness and stretching out of that muscle layer, essentially. And there are treatments then that basically would take those separated muscles and cause them to come back together. Surgery is the most obvious way. During a tummy tuck, we often will repair a diastasis. We will take sutures as an internal corset and we'll bring those muscles back towards the center. I do that in probably 80 or 90% of the tummy tucks that I do. And about 10 to 20%, patients sometimes don't need it because they don't have much of a diastasis. But those ones that do can really make a nice improvement for them. So surgery is one way to correct a diastasis. There are also muscle stimulating devices that can mildly improve a diastasis. And those are devices like M-Sculpt, like TrueSculpt, and CoolTone, where those muscles are stimulated to contract upwards of 20,000 times in a half-hour session. And for some reason, by doing that, you can get some mild reduction in the width of a diastasis. So that's a non-invasive way to do that. What I don't know, I haven't seen the studies on that, but are the diastasis improvements permanent? And that I'm not sure. I would think they might be, just because the diastasis is not necessarily due to stronger muscles, but separation of the fascia. And then there are exercises. If you've got a diastasis, the first thing I would recommend is not to jump to surgery, but to work with a physical therapist. There are defined exercises, core exercises that you can do that can help reduce a diastasis. And I've had some patients that have reduced their diastasis by upwards of a centimeter or more just by doing the right exercises. So that's the place to start, is with a physical therapist. See if you can work on those exercises to bring the diastasis together. If you're kind of close to where you want to be, you don't have excess skin of your tummy, and you just want to try to get that last little bit, then maybe some of these muscle stimulating devices like the M-Sculpt can potentially get you over that hump. Otherwise, if it's just too wide and you got that big separation, then you got to look at surgery. And the surgery that we look at for the tummy is a tummy tuck operation. Tummy tuck operations are surgeries where we remove excess skin from the tummy, as well as in some patients tighten up that muscle or basically repair that diastasis. Tummy tucks can come in the traditional tummy tuck where you have a hip to hip scar with a little scar around the belly button. That's what I do in about 80 to 90% of my patients. You can do a mini tummy tuck where essentially you just remove skin from the lower abdomen. You don't get any tightening above the belly button with a mini tummy tuck. And then there are the bigger ones like a fleur-de-lis tummy tuck where the scar goes from hip to hip and a scar goes vertically down the whole abdomen. And that is for people typically who've lost massive amounts of weight. And then there is the circumferential tummy tuck where the scar goes all the way across 360 degrees. In that situation, you can also get a lift of the buttock area, and essentially you're removing excess skin all the way around the body, kind of like almost like a donut or a spare tire type of a thing. So most patients who have tummy tucks because they've had a few children, the skin has gotten stretched out, and they go for the traditional full tummy tuck, usually with the rectus plication, which is that diastasis treatment. A small percentage will have a mini tummy tuck when there's just a little bit of extra skin, let's say over a C-section scar, then that works pretty well. And then once again, people who have massive weight loss, you're looking at the bigger operations like a fleur-de-lis tummy tuck or like a circumferential. Tummy tucks can take many hours. The average time for me to do a full tummy tuck is anywhere from 2.5 to 3.5 hours. A mini tummy tuck can take maybe an hour and a half in somebody who's real small. And then when you're doing a fleur-de-lis tummy tuck or a circumferential, that probably starts at like 4.5, 5 hours and goes up from there. Keep in mind, tummy tuck surgeries create lengthy scars. Those scars are permanent. They never disappear. And the recovery from tummy tucks can be pretty difficult. I tell my patients, a mini is usually not so bad, but it's the full tummy tuck and anything bigger than that where you're out of it for a good 2 weeks or so, where it's tough because everything's tightened up and it's right at your core, and it's hard to get up and walk and all of that. So it is a bit of a recovery. So these are the different ways to flatten your tummy. Hopefully, your issues are things that can be taken care of without going under the knife, but hopefully that gives you a bit of an introduction as far as what surgery can do for you if that's your main option to treat what you have. If you want to learn more about tummy tuck surgery, I do have a YouTube channel as well as an Instagram channel that's all about my patients. They're Youn Plastic Surgery on Instagram as well as on YouTube. Like always, eat real food, use clean skincare, and autojuvenate before you operate.